of my champion heroes of social innovators. But no, you've been going through the worst crisis of your history, right?
Yes, that's right. We've been able to impact 500,000 people in Northern California. But what's been really difficult now is that I think that many nonprofits, just like many businesses and many people who are living in California, it's really tough to run a business in California. We have a lot of innovation and we're having to borrow money to advance the mission, the work. So it's a big challenge right now.
Kathy, thank you for joining me again for the Innovate podcast.
Hi, Ted. Nice
You're
to
one of
be
them.
here.
You're one of my champion heroes of social innovators. So, it's been a challenging time for Lau family. Also, a incredible time to celebrate.
Yes, that's right. It's been quite a journey, I think, this year. I think the last 9 months, since the administration change, and I think lots of things have both been positive and negative, and there's also opportunity. So it's everything and above.
Okay, so what are the challenges? First of all, let's celebrate. What's the big milestone?
Well, this year, Lao Family celebrated our 45th anniversary. It's been an amazing journey, and we're really excited because we've been able to impact 500,000 people in Northern California. Actually, that includes Long Beach and Los Angeles County as well, but primarily in the Bay Area.
How many people?
500,000, nearly
That's a lot.
500,000. Yeah, it's a lot. It's 500,000. It's
500,000 people.
yeah, 500,000 people.
5 years.
That's right. They either got their high school diploma, they got a college education, they secure some sort of career technical education industry
So
recognized.
that's 10,000 a year, or about 10,000 a year for 50 years, more or less.
45, yeah, yeah,
11,000 ish a year
yeah,
for 45.
yeah.
That's a lot.
Yeah, I mean, La Family's really been growing at about 20% a year on average.
And you're saying these are people who got all these outcomes. So it wasn't people you gave a lunch to.
That's right.
Consider-
So you either, like I said, you graduated with a diploma, you have a job, you increase your income, you have health insurance, you've improved your mental health, substance use, your marriage, your relationship with your children, you've been able to buy a home, you started a business, you've been, the families have been lifted. We've been able to lift our families through developing our community.
That's really beautiful. To be honest, the first time I heard that, I had thought it was a little evangelistic. Like you guys, that, but you gotten that big number because those are people you'd reached out to and were part of a small outreach. But no, those are people who you've deeply impacted and influenced their lives. That's an amazing organization. And so now that you're 45 years established, it's all easy, right? The machine's running, but no, you've been going through the worst crisis of your history, right?
Yeah, I think so. I mean, one of them. I mean, we've gone through a lot. And of course, '08 and 12. I mean, we've been able to survive and thrive in whenever our economy is terrible, people are losing homes or they're losing their jobs. That's when the community needs us the most, both our government partners, the foundations, as well as the community members who need us the most. But what's been really difficult now is that I think that many nonprofits, just like many businesses and many people who are living in California, it's really tough to run a business in California. We have a lot of innovation. We have a lot of opportunity, but the cost of housing is extremely expensive, as you know. The cost of healthcare is very expensive, education and childcare. So that means that we as a corporation, as a nonprofit, we have to train people and give them opportunities where you have to find them opportunities where they can earn more because it costs so much more. So let's say our average income versus the price of housing is over 10x or even 14x compared to some other states where your income, the median income could be $70,000 per household. And then you're buying a home and the home might be 300,000 or 400,000. In that case, it's 3x or 4x. So you have more money for other things that you need with your life. But here in the Bay Area, I mean, if we're talking about $1.4 million for a median price of home, and your income is what, 78 or 80,000? I mean, that's 15, 16 times more than what you have. So, it's harder for us as a community, to find good jobs with benefits and also a career pathway. Um, so, like, if we're talking about digital literacy, we're talking about teaching individuals, who may be a refugee person. They might have been homeless. They came out of jail. And now you're trying to teach them AI. You're trying to teach them machine learning. And how do you do that? But you have to do it in a way where it's technical jobs. But, these kind of jobs are not the only good jobs, like blue collar jobs. There are lots of good blue collar jobs. And we need electricians. We need plumbers. We need people who work on ships and who drive trucks, who work at the ports or the
Let's talk
airport.
to a guy,
Yeah.
Jamco Foundation. He probably knows you. He was at Fairfield when we did that conference there, and you spoke of there in Sonoma County. And they have this apprenticeship program for maritime jobs. So you learn to either be a cook on the merchant marines, to either be a cook, to work to move the stuff, or to work on the mechanical of the ship. And he has 100% job placement, and the people make. And they go on a ship. They make, I think the entry level is like 60 to 80,000, but no expenses. So it's the equivalent of making double that.
You're absolutely right. And a few years ago, when we started as a partner in the Working Waterfront, it's called Working Waterfront. And that's the project. And it begins in Seattle. It goes all the way down to Long Beach. So La Family is a partner. We're doing the outreach and doing case management, and we're putting individuals into the shipping industry. So we started with blue and gold fleet for the recreational shipping. And then we also then started working with Bay Shipping, which is the operator of the ferry service for the commuter. And so we had a graduation in Mare Island just a few weeks ago. And of the 23 students, the apprenticeship students who were graduating, 12 of them actually came from our family. So we had a mix of both Burmese, young adults, like, 21 to 30-year-olds. We had African American trainees. We had Latino trainees. So we really brought a lot of diversity to the apprenticeship class. And it's harder than ever, like going back to what you originally asked me about, because right now, what we're finding is that there's a lot of delays in the government contracts because there's a lot of negotiations that's going on now between the federal administration, various departments, whether it's HUD or it's like health or it's workforce dollars or it's medical dollars. There's a lot of negotiations right now between the administration, those departments, and then the states and the counties, cities, and the nonprofit sector. So, like for us as an organization, even though we have 65 contracts, which is our mission work, a lot of those contracts now are delayed. And instead of getting renewal on October 1st today, the RFP actually was delayed, and there's going to be no renewal for a lot of people. And this is on top of, like, say, about a year ago, about 10 months ago, 9 months ago, when the refugee program for the United States was canceled. So, that affected us with $1.8 million. And, we had to lay off 16 employees. And then there's workforce dollars that are affected. And now HUD dollars are affected for housing, medical. And so it's more important than ever now that we as a sector have to learn and figure out a way to really reach out to the community and the private sector about supporting nonprofits, because these mission work that we're doing, we can't fund them now because of reductions in government contracts, or there's tremendous delays, and we're having to borrow money to advance the mission, the work. So it's a big challenge right now.
These are the challenges. Okay. So you're having to pivot. I was thinking, I wanted you to share like the challenges that you're facing that other leaders in your position are facing. What are the opportunities that you see out there? Maybe we have to weather the storm, but then what are the opportunities that are out there? And then how can you pivot? How are you pivoting and how can others pivot? A lot of our friends are going out of business. It's heartbreaking.
It's true. I mean, we had a group that we work with in the East Bay. They're here in San Francisco too, and they've been around for 28 years, and they literally just shut their door at the end of June. So there are many groups that we know of who are shutting down their doors or etc. For us, how are we gonna like survive through this and then actually thrive, right? So some part of it, we started pivoting actually 3 years ago. We were doing really well, and then we had a sense that the administration was going to be shifting. So we made a decision 3 years ago to pivot into healthcare. So it took us a lot of time and investment. It was really, like $500,000 investment that we had to go through accreditation, credentialing. And then we had to do a lot of investing because we didn't even get paid for delivering Medi-Cal services, innovations in Medi-Cal healthcare. So we're finally, like, for example, in one of our contracts, working with the Medi-Cal insurance company to deliver enhanced care and housing navigation for those who are homeless and in the ER or, on the hospital beds. We just got paid for our work in January.
Okay. And how long was it delayed?
Well, it's we didn't get paid until like the month of September. So it took us about 9 months after we delivered the service to be paid. And that's really hard because we have to borrow money, between 7% to like
But
10%.
now you're all set up. In other words, this is a barrier to entry, but you've crossed over that barrier. Now the payments will be coming regularly. And
That's what we hope.
oh,
Yeah, that's what we hope.
oh,
Yeah, so we've been told that it takes about 1 year to when you're working with these health insurance companies for the technical aspects of the billing, the software, the coding, all to work well. So we're hopeful now that our work for the service that we've delivered to the community, the impact we made already, that we can actually get paid more timely now. So I think that moving into healthcare,
you're not nurses, you're not doctors. You're what technically are you?
well,
You're
so
workers for healthcare?
yeah, so our healthcare that we have is complex. So we are hiring, we partner with, and then some of our partners are the ones that have the MDs and the RNs and the licensed social workers and licensed therapists. But we're in the middle of contracting ourselves, also with employees and contractors who are MDs and PAs and RNs and
So you'll contract and maybe even employ
yes.
MD. Oh, okay. So you're fully going into managing healthcare.
Yeah, so it's care planning, and we have supervisors who are basically licensed medical personnel. And then we're also partnering with other groups. For example, one of our facilities we're negotiating right now is to bring in a fully licensed substance abuse as well as mental health therapy organization. They'll be housed with us at our facility to provide both outpatient service as well as inpatient, like medical beds, medical care with beds. So I think finally the last thing I think that so trying to figure out like which sector you're going to pivot to that makes sense for you that's within your mission because you don't want to mission creep. The second part is you have to figure out like what is the earned revenue, the social enterprise or the earned revenue that makes sense for your organization. For Lao Family, it's been real estate development and commercial real estate development and residential. And we've been really financing those acquisitions and renovations with private dollars, with private loans and our own equity. But the part that we really need help with, that I think we can learn a lot more, are organizations are really good at engaging with the wider community and creating fellowship and a way to onboard community members about why we need their support and to give them the opportunity to come and tour, to talk to the people we've impacted, and understand the math and the financial picture of why their donation dollars are really critical to the mission work.
So you're also pivoting into direct donation too.
Yes, that's an area I think that we have a big opportunity. Honestly, I think we're deserving of the community's financial support. We really put 90+% of dollars into direct service to the community. And, we're not like traditionally, we've never really traditionally gone in to ask the community, the business community, landlords, um, individual families, individuals to support our work. But it's needed more than ever right now.
Yes. And the tax code, the rewriting of the law, basically is yanking back on government services providing money, and it's also going to be a windfall for high net worth individuals, well, middle class to high net worth individuals. They're going to, their taxes are going to be cut, and they're going to get more money back. So, give to La Family.
Well, thank you. There's many deserving organizations, and we hope that as the community, we get out there to brand ourselves, to market ourselves, to promote ourselves for our good work and our impact, that hopefully there'll be an emotional connection with the donor out there who recognizes the impact that we're making, and it might be something that is in value with them and their family. And if there's a way that they can partner with us and support this work so we can elevate and lift the community together. Yeah.
Wonderful. Well, thank you so much. So, closing thought here is your last question. Okay. So, your 45-year organization, your father founded it, he led it, and then you took over what?
Almost 20 years ago.
Almost 20?
Yeah, officially, I applied for his job in late 2005, and I came on board part time in '05. The last 2 weeks of '05. Then I came on board full time. And it's been an honor and it's been hard work. I've learned a lot. I've met wonderful people. And we need to go to the next stage so that we can sustain this organization and I could pivot into a different role. And I could basically, we're grooming the next generation because we have to. We have to groom the next generation. And I want to invite everybody who sees this to come and learn more about us. We're having an event October 24th in the city of San Pablo to celebrate our 45th. And we'll be celebrating on October 30th in Oakland. And our doors are open. Everyone's welcome. Come and learn about us and let us learn about you and see what we can do to work together to lift our
You
community.
also produced an amazing documentary. Can that be viewed on your website yet?
What we're actually, once we have these two events on October 24th and October 30th, then we're going to make the YouTube of it available on our
Okay,
website.
so I want you to give it to me, and I'm going to give, if you don't have a little trailer yet, I want to get off when we're going to edit into this video a little clip from that so people can see that and get a preview. Just a preview. So,
Okay,
Good
thank
clip.
you.
You're going to see that this amazing documentary you produced, and
Thank you.
wonderful. All right.
Thank
Oh,
you.
I love those closing words. The closing words are think generationally. And I love how you right now are thinking in the prime of your life. You're thinking of a multi-generational organization and training the next generation to go even further than you, the same way that you went further than your father who founded the organization. So,
Well, big shoes to fill, but the ripple effect of the work of the heart, the tears, the money, the time, of the people before me, my father's generation, and between him and me, there's lots of people, and that we need more people to live moving onward. So thank you.
well, thank you for your good work and thank you for joining me again.
Thanks, Ted. Appreciate
Thank
it.
you for your attention.